welcome to our Monday Minute. Today we're going to discuss the release of the final rule for the Medicare Advantage Programs for 2026. The Medicare Advantage Programs have received a 2.83% increase in rates. That is payments made to the Medicare Advantage plans from the federal government to support health care of their beneficiaries. They have also initiated a 3-year phase-in for removing medical education costs from the Medicare Advantage plans. They're also completing a 3-year phase-in of improvements to the Medicare Advantage risk adjustment model that the agency finalized in 2024. They have concurrently released a regulation to redesign the Medicare Part D program. In the Medicare Advantage rule, in working with the risk adjustment data we already talked about, they have implemented some cost sharing with insulin and vaccines. Medicare prescription payment plans have been enabled for more out-of-pocket to be distributed across the year instead of these seniors being stuck with huge drug bills 1 or 2 months out of the year. And they have looked at timely filing or timely submission requirements for the prescription drug event records. Some of these things may not mean a whole lot to you from a home health or hospice standpoint, because much of it surrounds the Medicare Advantage plans and how they provide services or coverage to their beneficiaries. However, do remember that the Medicare Advantage plans are a huge part of home health, especially right now, and they're not going anywhere. Statistically, approximately 75% of all U.S. citizens that turn 65 years old today will elect a Medicare Advantage plan versus traditional Medicare. There is more and more effort being put toward pushing Medicare to privatization, which of course would mean into Medicare Advantage plans. The Medicare Advantage plan open enrollment period, as you know, is October through December 7th. That open enrollment period is not the only time that your Medicare Advantage beneficiaries can change their coverage. Anytime throughout a given year, they can move from the plan that they're on to a 5-star rated Medicare Advantage plan, even possibly going from one 5-star plan to another. It is a situation that many want to ignore, but it absolutely cannot be ignored. Medicare Advantage plans must be dealt with. In most states, not all, but in most states, in most counties, in most states, there is greater than 30% saturation of Medicare Advantage plans, some as high as 75%. So it is a situation that we must deal with if we plan to succeed in home health. Healthcare Provider Solutions stands ready with staff members who can assist you in not only negotiating being in network with Medicare Advantage plans, but also able to assist with renegotiating your current Medicare Advantage contracts. Please don't hesitate to reach out if you would like assistance with that. Thank you and have a fabulous week.